Hi, welcome to POC Nurse. In this video, we're going to talk about anaphylactic shock for the CCRN exam. What is anaphylaxis? Anaphylaxis is a kind of allergic reaction. It occurs fast and it can cause a person to die. It can cause death. Anaphylactic reactions usually happen after a patient has been previously exposed to a substance. So let's say the patient is allergic to a certain food. The patient could be exposed the first time and develop antibodies, and then subsequent exposures will cause these antibodies to react to this food that the patient is allergic to, thereby causing an allergic reaction. Patients manifest allergic reactions in different ways. That is, they show allergic reactions in different ways. Sometimes they may have hives, angioedema, trouble breathing, and sometimes these allergic reactions could progress into shock. 88% of the time, approximately, of course, the patient may have hives and angioedema. Their airways may be involved in approximately 50% of cases, so the patient may have trouble breathing, bronchospasm, or just respiratory issues in 50% of cases involving anaphylactic allergic reaction. 30% of the time, approximately, the patient may have shock, or the patient may progress into shock. That is anaphylactic shock. Anaphylactic allergic reactions are usually caused by antibodies. They are caused by IgE antibodies. And what these IgE antibodies do is that they stimulate the body to release chemicals such as histamine when the patient is exposed to a substance that can trigger an anaphylactic reaction. Now, this histamine can cause vasodilation in a patient. It can also cause bronchospasm. So the patient may become hypotensive and the patient may be having trouble breathing. How do we treat anaphylactic shock or an anaphylactic reaction? For the CCRN exam, things to know is to remove the agent or the substance that's causing the anaphylactic reaction. So if the question says you started penicillin on this patient, suddenly they have trouble breathing, their blood pressure is dropping, if they give you numbers, what is the first thing you do? Stop the penicillin. Remove the offensive or the offending agent. If the patient is having trouble breathing, you may give the patient supplemental oxygen. Now, epinephrine is something that can be given to a patient having an anaphylactic reaction. When I say epinephrine, I mean that like the EpiPen IM epinephrine. What the epinephrine does is combat the vasodilation that the patient is experiencing. So it reduces the vasodilation and causes vasoconstriction. The epinephrine can also help the patient if they're having trouble breathing, if they're experiencing any kind of airway constriction or bronchospasm. The epinephrine will help with that. The patient also gets fluids, and antihistamines are also given, such as Benadryl, to reduce the patient's allergic reaction. Remember, histamine is the chemical that's causing this vasodilation and causing the patient to have trouble breathing. Also, to combat bronchospasm, the patient can receive respiratory treatments such as inhaled beta-adrenergic agents to reduce the bronchospasm. Finally, the patient receives or may receive steroids. What the steroids does is to reduce inflammation. So if the patient has inflammation in their airways, giving them steroids will help reduce that inflammation and help them breathe better. This is where we're going to stop for anaphylactic shock for the CCRN exam. I hope you found this helpful. Please like, share, and subscribe, and I will see you in the next video.